Imagine you're 40,000 years old, not the year, you, your body. And 3 days ago you cut your leg open on a rock while crossing a stream. It wasn't deep, it didn't even bleed that much. But now the skin around it is hot, swollen. There's a smell coming off it that wasn't there yesterday. You can't put weight on it without your vision going white at the edges. There's no hospital, no antibiotics, no one within 100 miles who's ever heard the word infection. There's just you, your group, and whatever they've learned by watching people live and die for generations. And here's the part that should terrify you. In a world like that, a scraped knee could kill you faster than a lion. Today, when you get sick, you take something out of a bottle. You barely think about it. Headache, you swallow a pill. Cut yourself, you slap on a bandage treated with chemicals your body doesn't even have to fight. You don't understand how any of it works, and you don't need to. Modern medicine is invisible to you the same way electricity is invisible. It's just there. But for most of human history, getting sick wasn't a minor inconvenience. It was a roll of the dice with your life on the table. And the strange part is, ancient humans weren't helpless against it. They built an entire system of medicine, real medicine tested over tens of thousands of years, long before anyone knew what a bacteria was. So what actually happened when someone got sick 50,000 years ago? There were 3 killers hiding inside every illness, and all 3 could take you out before your group even understood what was wrong. The first is infection. A small wound with no antiseptic is an open door. Bacteria don't care that you don't have a word for them yet. Left untreated, a simple cut could turn septic within days, and sepsis in a world with no IV fluids is almost always fatal. The second is fever. A high fever left to run unchecked doesn't just make you tired, it can cook the proteins in your own brain. Ancient humans didn't know the mechanism, but they absolutely knew the pattern. Someone gets hot, someone starts talking nonsense, someone doesn't wake up. And the third, the sneaky one, is dehydration. Diarrhea, vomiting, sweating through a fever. In a world without clean stored water on demand, these could kill a healthy adult in under a week and a child in under 2 days. So a body getting sick wasn't a background event. It was an emergency that could unravel fast with no way to slow it down. Except that's not quite true, because they did slow it down, and the evidence for how is written directly into the archaeological record. Let's start with the oldest and most surprising piece. At a Neanderthal site called El Sidrón in Spain, researchers analyzing dental plaque, actual calcified plaque scraped off 49,000-year-old teeth, found traces of poplar bark. Poplar bark contains salicin, the same compound your aspirin is built from. That Neanderthal had a dental abscess and appears to have been self-medicating with a natural painkiller he had no chemical explanation for. He just knew it worked. The same study found traces of a mold related to modern penicillin in that individual's plaque. Not proof of deliberate antibiotic use, but proof that ancient hominins were already testing what the world around them could do to their bodies, tens of thousands of years before germ theory existed. Move forward to Sidrón Cave in Iraq, another Neanderthal site. This one around 60,000 years old. Pollen analysis around one burial revealed clusters of plants known today for medicinal properties: yarrow, cornflower, groundsel, species still used in folk remedies for wounds and fevers. Some researchers argue this individual, who had clearly survived serious injuries earlier in life, including a crushed arm, may have been cared for using these very plants while healing. That detail matters more than it seems. A crushed arm in a hunter-gatherer group isn't a minor injury. It likely meant someone couldn't hunt, couldn't carry, couldn't contribute for weeks or months, and yet the skeleton shows healing. Someone fed this person, protected this person, and possibly treated this person long enough for broken bone to knit back together. That's not instinct, that's medicine as a social contract. Now jump to Homo sapiens and the evidence gets even more specific. At Sidrón Cave in Italy and independently in Australia, archaeologists have found chewed remnants of plants known to contain antimicrobial compounds, alongside skeletal evidence of healed infections that should have been fatal without some kind of intervention. People were surviving wounds that, statistically, shouldn't have let them survive. And then, there's one of the most direct pieces of proof we have, a man who isn't ancient in the deep time sense, but ancient enough to matter here. When Ötzi the Iceman was found frozen in the Alps, 5,300 years old, researchers didn't just find a fire kit in his belongings. They found birch fungus threaded onto a leather strip and carried on his person. That fungus, Piptoporus betulinus, has documented antibacterial and antiparasitic properties. When they examined Ötzi's intestines, they found whipworm eggs. He was carrying medicine for a condition he was actively suffering from. Think about that. Over 5,000 years ago, a man walking through the mountains was carrying a targeted treatment for an intestinal parasite on purpose because someone before him had already figured out that specific fungus did that specific job. So how did they even know? This is where it gets interesting, because the process wasn't guesswork the way we imagine it. It was generational trial and observation, repeated over thousands of years, refined and passed down, the same way tool making was passed down. Someone eats a plant and gets violently sick. That plant gets marked as dangerous. Someone chews a different bark, and their fever breaks a little faster than it should have. That gets remembered, tested again the next time, and again after that. Across enough generations, across enough repeated trials, a group builds an actual pharmacological library, stored entirely in memory and passed through demonstration and story. And this is where fire comes back into the picture, because sickness, like rain, forced people into stillness. A person too sick to hunt, too weak to gather, had to be tended by the fire, inside the shelter, while others cared for them. That closeness, that forced proximity, is very likely where a huge amount of medical knowledge actually got transmitted, not in a classroom, around a body that needed help, with someone older explaining step by step what to try. There's also a colder side to this. Ancient medicine wasn't just herbs. Archaeological evidence from multiple sites shows trepanation, the deliberate drilling or scraping of a hole into the skull, dating back over 7,000 years in some regions. It sounds brutal, and it was. But here's the part that should stop you. Many of these skulls show clear signs of bone regrowth around the hole, meaning the patient survived the procedure, sometimes for years afterward. Someone was performing actual surgery, with stone tools, on a conscious or semi-conscious patient, and getting people through it alive often enough that the practice continued for thousands of years across completely unconnected cultures. That's not superstition stumbling into occasional success. That's an early, brutal, but genuinely functional medical practice, refined the same way flint knapping was refined, by watching what worked and repeating it. By the time you get to settled societies, this knowledge starts getting written down instead of just remembered. Ancient Egyptian medical papyri, some dating back over 3,500 years, list hundreds of specific treatments, wound care instructions, and even something resembling a triage system, sorting injuries into categories: treatable, uncertain, and untreatable. That last category is almost more revealing than the other two. It means someone, thousands of years ago, had enough clinical experience to know which injuries weren't survivable, and said so honestly in writing. So when you put the whole timeline together, it looks like this tens of thousands of years before anyone understood bacteria, a Neanderthal in Spain was chewing bark for pain relief. Around the same era, a badly injured Neanderthal in Iraq was being kept alive by a group willing to feed and protect him through a recovery that took months. By the time modern humans spread across the globe, they were carrying targeted treatments for parasites on their bodies, on purpose. And within a few thousand more years, people were performing survivable skull surgery with stone tools and writing down which wounds could be saved. None of that happened by accident. It happened because getting sick, like getting rained on, forced people into a position where the only way through was attention, memory, and care passed from one person to the next. And that's really the point buried underneath all of this. We tend to imagine ancient humans as barely surviving, one bad day away from extinction, with nothing but luck standing between them and death. But the truth is messier and a lot more impressive. They built a functioning system of medicine out of nothing but observation and time. No labs, no germ theory, No written records for most of that span. Just generation after generation testing the world around them, remembering what worked, and passing it down before it could be lost. So the next time you take a pill without thinking twice about it, remember that the impulse behind it, someone noticing that this specific thing helps this specific problem, is not new. It's not modern at all. It's one of the oldest instincts our species has, stretching back to a Neanderthal with a toothache, chewing on a piece of bark, 49,000 years before anyone would ever explain why it worked.